Hey, this is another case study looking at a case for a full upper arch. Now, the case study for the full upper arch in this is really pretty tricky, and it has to do with the bone density and it has to do with the sinus if you're trying to avoid the sinus lifts. If you're not trying to avoid the sinus lifts, it kind of opens up new possibilities, except that the bone density is not very good. So you're always going to run into this problem where people have lost their teeth and have poor bone density, and it always needs to be addressed. And so this is one of those cases. From a panoramic view, it looks pretty good, except the sinus area is here. But let's actually look at what the treatment assessment actually says. So I gave it a orange bone density, a facial bone, and a detached gingiva, bone characteristics, and ridge height all got orange. I gave a couple reds, one in bone constriction because of the anterior bone and the sinus bone on these areas here. This patient already has experience with some very old implants or some possibly newer ones. These kind of looks like they're press fit. These might be Innova implants. I bought those probably about 18 years ago. They've been long since gone. They may not be, I'm not sure, but they look just like this. They're very beaded implants and they were press fit. So that seems to have worked. Actually, there's a lot of bone actually around the implant area and not so much underneath it. So the stress of the implant is maintaining the bone characteristics. That actually looks pretty good. Let's look at the other side real quick. We can look at this one. This looks like a more contemporary implant. Same thing. Some of the bone characteristics right around the implant. It's a lot heavier, probably because of the use and the wear and tear, and then she's become more and more osteoporotic. And if we look at that last one on number 30, that's what it looks like here. So the bone quality looks pretty good right into this area here, right around the implant. It looks great. And then you see we kind of lose the bone density down here. So let's look up at this area here on the upper. We're right into the first molar area right here. Let's look back at the pano view, and we are looking at that line right there. So we're just at the point where we're stepping into very, very thin bone. Let's go a little bit more anterior, let's say about here, and you can see the bone quality just completely starts to go away. She does have some bone, but it's pretty soft, pretty thin. There's not even a lot of cortication on the bone up here into the sinus area. If we put an implant in, let's say it's this 3.7 by 10. Let's just look at it for sizing. And we're going to try to see if we can do a 4 to 6 locator system or a hybrid system if you want to do a hybrid. So I'm not a fan, but that's what you get. So you would have to do a sinus bump here, and you would get it in a nice posterior position. So the next sequence of events that I do, I quickly scan through the quadrant here just to see how far I could go. So let's look at that slice view. I'm going to scan again so you can see it. And I'm going to go through, everything looks pretty good, and then no, it doesn't look good. The constriction kills me here, probably right into the canine area here. So right there is kind of no man's land. So we got to back it up and see what we could do there. Now, once again, the bone quality is there, except it's starting to look a little bit thin again. So let's look at another 3.7 by, let's say, 11.5. And you can get it in there. It's not that you can't. How well would that stay? Probably pretty well if you bury it a little bit. You want to get away from the crestal part. What I see a lot is that this bone out here, this facial plate, when it's that close, tends to resorb away on these full arch cases. and that creates like a little bit of an ailing scenario for the long-term hybrid or locator cases. Now, you could do this. My recommendation probably would be to try to aim for something here, because here's where you get a little bit more width of bone, and maybe we can do something a little bit thicker. Let's still put in the 3.7 by 11 just to size that up and see what we like. And that's probably a little bit long. Maybe we go to a 10. So I would feel okay with that. I just would, let's just change that real quick to a 10. That should be the 10 right here. All right, so a 10 is really, really nice there. It's got a lot of bone around it. So this looks pretty good. Now, the next thing I want to do is actually then look at, do we have something else to achieve on this side here? You can see under the CT, it's not an exact science in terms of how level the patient's head is, but it's pretty darn close. It looks like we can probably get implants in the same row here. I'm going to actually bring that up a little bit closer to the top of the crest, right there. Okay, so now we're at the crest of that bone right there. This is where you get a good idea of what's thicker. So here's where we have that defect that constriction really kind of knocked us out. I don't really like stuff in the anterior because you sometimes have problems trying to move teeth forward or back. But over here looks pretty good. So let's look at the distal part. And you can bring it all the way over here, and I would stop maybe about there, but let's angle that to the right position, right about there. Let's look at that. Okay, so now our bone density doesn't look too bad. That looks good. And I would also say you're going to have to go into the sinus again, and you should get some really good stability there. Let's go with the 10 again. Just to see what we got to do. So you can do the hydraulic sinus lift, and you can kind of move it up. You could even do something wider here, which would be nice. Let's do a 4.2 by 10. I would pretty much prefer to do something like that. That would be nice, and you're just a few millimeters into the sinus area, but what we're getting is a nice spread. So let me go a little bit more into the anterior area, probably. Yeah, this is very angled, and that's where hybrids might work out okay, yeah, if you're gonna, it's kind of tough. You could possibly get something in here. Let me put one right down in the anterior, right in the middle here. Let's just do that to see what we could do. Yeah, that one's really tight. I don't think that's a good idea, but let's just play around with this. All right, let's do an 11.5 by 3.7. See what that looks like. We are pretty close to not doing that one. This could work. You could get that in. You could do a ridge split here. This is a good ridge split area. If you're inclined to do that, that's definitely an advanced technique, and get something in the anterior. The only reason why I really was looking at that anterior zone is because the patient happens to have kind of a non-supportive anterior position where the bone, the structure is more of a class 3 on the bone side. I'll look at that. I'll show you in a second what I'm talking about. But here is where we could bring in, see how this looks here, because this gets really constricted on this side. I thought we had a little more bone on that upper left side, but definitely not. So here we go. So you could do this. This is an interesting placement here. You can get rid of this one, do 5. I don't like a hybrid on here. I would rather do a bar over denture on maybe this whole thing. If you did 5, if you took this one away and you had these 5, you could do a bar over denture with the locator here. I'm going to put a little line. Maybe not even that far back, but you get the idea. Let's say we did a locator attachment on the bar here. You do a locator attachment here. You do a locator attachment here. And then you do a locator attachment even way back here if you wanted. I guess that would be pretty symmetrical. So this would be a really solid overdenture, bar overdenture locator for sure. You're not going to have any anterior working here. You got a very good support because you can get that bar to help support. Let me go back to that interior part I was talking about. I'm looking at the lower teeth and I'm looking at the line angle of the anterior bone. So the bone is here. Your teeth are here on the anterior coming up like this. Your anterior front teeth are probably going to end up being in a class 1, which is going to be like this. So let me get that back. So as the patient bites, the patient's pretty open, so it's kind of hard to say. But when the patient bites, the force is really going to cantilever off of this front part here because the bone here relative to the pressure, the support is not compressive. It's much more kind of in a lateral way. So you're going to be banging on the upper front teeth here and bringing down the forces on the posterior. So having this one implant right here could really help not cantilever, but help support that problem. If you did not have that one, and let's look at this view. If you didn't have this one, forget this one, but if you had it in this arrangement, we have a really nice spread. I'm almost never recommending anterior implants, and I'm almost never recommending a spread of teeth way out here either, because if we did not have this one here, then you would be relying on these posterior teeth to, if you had a locator attachment system, to really step it up. And patients love to bite on the front teeth. I don't know why, but they will always want to bite on the front teeth, and they will always overload the leverage on that. So this would help support that leverage on the front and maintain at least some sort of balance against the pulling off of the denture as they complain that they're biting too hard on the front teeth. You could also do this with a hybrid piece as well. The problem I have with the hybrid is that when it's fixed, it puts too much weight and force directly on the implants, and in this case, it's on the restoration that's going to crack or break. So I'm not a fan of a fixed piece. You've heard me say it many times. This will hold an overbar, but over time, are these implants, the diameters, good enough to maintain the strength that a hybrid needs to do? Probably. Clear Choice says, hey, just tell the patient don't chew on anything hard. So, I do tell the patients to use it as a tool, take care of it, don't overforce it, but to tell them that they can't for the rest of their life chew on what they want to chew on, I say take care about what you're chewing on and try to soften things up. And maybe that's why mine break more often, but they have more of a liability clause. I think they have that breaks just like anybody else, because I've seen those as well. And people are frustrated with that. So in this case, there's only so much strength you can do to a denture fixed hybrid piece to keep it strong, but it comes down to use and abuse and the strength of the jaw that can actually bust that restoration. So I'd rather have it pop out than it fatigue over years. And we're talking, 3 to 5 years. I'm not talking 3 to 5 months. I'm talking 3 to 5 years, patients start coming back. and they start going, hey, this is already cracked. They don't want to pay for another fix, I can tell you that. Then you got to unscrew the whole thing and get it repaired and all of that business. So try to stay away from it if you can. This is an interesting 5 implant. If you want, you can add an implant here. Another implant spot might be right over here, right on this side. And that would be another interesting combination. The bone is there just like the other anterior zone. Like I said, once you put that anterior implant, you got to figure out how not to make it too bumpy or too bulky for the patient's tongue, no matter what prosthetic you do. So anyway, that's this case study for a full arch. Definitely for a more advanced dentist that understands the loads and the prosthetic options going on in combination of the surgical and the surgical limitations you have here. If you're inclined to do bigger sinus lifts, you can do the lateral sinus lifts and maybe get bigger implants up into those areas as well. So that concludes this case study here. Please take a look at our other case studies. Also, go to some of our live streams and you can make some comments and ask some questions there, or comment on any of these videos here. Like us on Facebook and subscribe to us on YouTube, and take care.